रिकॉर्ड कर लें पहले आप साथ रिकॉर्डिंग का। बिस्मिल्लाहिर्रहमानिर्रहीम। Yesterday's presentation with the quote that knowledge is of no use. Today's the topic of presentation is Zika virus disease, and uh, we will cover it about the introduction of Zika virus, epidemiological determinants, clinical manifestations, level of prevention, and recent advances about the Zika virus disease. And by the end of this presentation, we'll be able to understand about the mode of transmission of Zika virus, possible ways and means of prevention of Zika virus, and national and global updates about this disease. Let's start with the introduction. Zika virus was first uh, identified in 1947 in Uganda forest. It's a mosquito-borne flavivirus 1. It was identified while the yellow fever was being monitored. Later on, it was identified in humans also in 1952 and in Tanzania also. So from 1960s to 80s, human infection were found across Africa and in the Asia. The first large outbreak was reported from island of Yap, Federation of State of Micronesia in 2007. In July 2015, Brazil reported an association between Zika virus infection and Guillain virus syndrome. Well, in October 2015, Brazil reported an association between Zika virus infection and microcephaly. Outbreak of Zika virus disease have been recorded in Africa, America, Asia, and the Pacific region. Here are the two species of the mosquito. Aedes aegypti and Aedes albopictus. These are responsible for transmission of this virus. About the agent, it's a single-stranded RNA virus, belongs to genus Flavivirus and the family is Flaviviridae. It's closely related to dengue, yellow fever, Japanese encephalitis, and West Nile virus. It's primarily it's is transmitted through the bite of infected Aedes species mosquito, that is Aedes aegypti and Aedes albopictus. Incubation period of Zika virus disease varies between 3 to 14 days, and Zika viremia ranges from few days to 1 week. Virus remains in the semen longer than the blood. We will see later on how it remains there for longer period. This is the message: protect from mosquito and be safe from the Zika virus. The mode of transmission of the Zika virus disease is bite from the infected mosquito. This is primarily the mode of transmission. And the other method, the person can be infected is a maternal, fetal, periconceptional, intrauterine, perinatal, sexual transmission from infected person to his or her partner, and laboratory exposure, and lastly the breast transfusion. Transmission primarily, as I said, to the infected mosquito, mainly Aedes aegypti. Aedes mosquito usually bite during the day, peaking during early morning and late afternoon. That's at dusk and dawn. This is the same mosquito that transmits dengue, chikungunya, and the yellow fever. Sexual transmission of virus can also occur. Other mode of transmission, such as blood transfusion, has also been observed. Sign and symptoms. The symptoms are similar to other arbovirus 2 infections such as dengue and include these signs of symptom: fever, skin rashes, conjunctivitis, muscle and joint pain, malaise, and headache. These symptoms are usually mild and last for few days, like 2 to 7 days. This is a pictorial presentation about how the sign and symptom: headache, pink eyes, red conjunctivitis, swollen lymph nodes, joint pain, and muscle pains. If you could key effects about the Zika virus, it's caused by a virus transmitted, as I said, Aedes mosquito. People with Zika virus disease can have symptoms including mild fever, rash, conjunctivitis, muscle pain. and these usually last 2 to 7 days. There is a scientific consensus that the Zika virus is a cause of microcephaly and the trigger for Guillain virus syndrome. Links to other neurological complications are also being investigated, and we will discuss it at the end when we discuss about the recent updates about the Zika virus. A little bit about the complication of infection. Zika virus during pregnancy is a cause of congenital brain abnormalities, including microcephaly, and that the Zika virus is a trigger of Guillain-Barré syndrome. What is Guillain-Barré syndrome? It's a rare condition in which a person's immune system attacks the peripheral nerves, which can result in temporarily muscle weakness and the loss of sensation in the legs and or arms, occasionally causing life-threatening paralysis. This is the picture where the possible outcome of the Zika virus disease once the pregnant woman is infected and the newborn uh, uh, may have microcephaly, the outcome of this disease. This is a picture of baby with the microcephaly due to the Zika virus disease. Diagnosis of Zika virus is based upon symptom and relevant epidemiological links, including recent history of travel to the endemic or area. For example, residents in or travel to an area with an active Zika virus transmission, sexual history with someone with Zika or return from Zika affected area or recipient of blood transfusion. All of them may cause Zika virus transmission, and diagnosis of Zika virus infection can only be confirmed through laboratory tests on blood or other body fluids, such as urine, saliva, or semen. Treatment, as far as treatment is concerned, there is no specific treatment. Currently, no vaccine is available. Luckily, the symptoms are usually mild and require no specific treatment. The people sick with Zika virus disease should get plenty of rest, drink water, plenty of fluid, and for the pain, pain and fever, symptomatic medicines are given. Congenital virus syndrome, Zika virus syndrome. The spectrum of abnormalities along with Zika virus exposure in vitro is known as congenital Zika virus syndrome. And as we discussed the microcephaly and Guillain Barre syndrome, we will discuss a little bit more. In addition to microcephaly, a range of manifestations of varying severity has been reported among newborns and infants where there have been exposure to Zika virus in utero. These include malformations of the head, seizures, irritability, swallowing problems, limb contractions, hearing and sight abnormalities, and brain anomalies detected on neuroimaging. Other outcomes associated with Zika virus in utero may involve miscarriage and stillbirth, failure to observe the signs of Zika virus, particularly when assessed in utero doesn't necessarily mean that the fetus or newborn doesn't have abnormalities. For example, abnormalities such as hearing and sight problem may not have been detected in utero until unless after birth. Some signs such as seizure may develop only after birth. Sexual transmission, the important aspect of this Zika virus disease, it can be transmitted through sexual intercourse, and it is of concern due to association between Zika virus and adverse pregnancy and fetal outcomes. For the regions of active transmission of Zika virus, all people with Zika virus infection and their sexual partners should receive information about the risks of sexual transmission. WHO recommends sexually active men and women correctly consult and afford a full range of contraceptive methods and be informed about the choices of contraception, whatever is possible at that particular point in time or the geographical area. Women who have had unprotected sex and don't wish to become pregnant due to concern about Zika virus infection should have a ready access to emergency contraceptive services and counseling. Transmission in pregnancy, it can be transmitted from mother to fetus during pregnancy and resulting in microcephaly and other congenital abnormalities in infants, collectively referred to as congenital Zika syndrome. Microcephaly is caused underlying abnormal brain development, loss of brain tissues, and child outcome vary according to the context of brain damage. Congenital Zika syndrome include other malformation also including limb contractures, high muscle tones, eye abnormalities, and hearing loss. The risk of congenital malformations following infection in pregnancy remains unknown. An estimate of about 5 to 15% of infants born to infected women with Zika virus during pregnancy have evidence of Zika-related complications. Congenital malformations may occur following both symptomatic and asymptomatic infections. Prevention uh, about Zika virus is first of the mosquito bite. Protection against mosquito bite during the day and early evening is the key measure to prevent Zika virus. Special attention should be given to mosquito bites among the pregnant women and women of reproductive age and childbearing age. Personal protective measures include wearing clothes that cover much of the body as possible, usually physical barriers such as window screens, closed doors, and applying insect repellent to the skin or clothing that contains DEET, IR 3535, or icaridine according to product labeling. Young children, pregnant women should sleep under mosquito nets if sleeping during the day or early evening. And advice for travelers is that those who are living in the affected area should take the same precaution to protect themselves from the mosquitoes as the other people are there who are living there. Travelers should observe the same. Sorry. Aedes mosquito breed in a small collection of water around the homes, schools, and work sites. And it's important to eliminate these mosquitoes breeding site, including covering water storage containers, removing standing water in flower pots, or cleaning up trash and used tires. Community initiatives are essential to support local government and public health programs to reduce mosquito breeding sites, and health authorities may advise use of larvicide and insecticide to reduce the mosquito population. Outdoor control of mosquitoes, the measures recommended are once a week empty and scrub, turn over, cover, or throw out the items that hold the water, or tightly cover the water storage container. Use larvicide to kill the larvae. Use outdoor insect spray made to kill the mosquitoes. And if you have septic tank, repair the cracks or gaps. Indoor control use of window door screens, air conditioning when possible, once a week, empty scrub, turn over, throw away the item which hold water. And if you have mosquito inside your home, use indoor insect fogger or indoor insect spray. When using insecticide, always follow the instruction on the label. Preventive strategies for babies and children, dressing the children with clothing that cover arms and legs. Children under 2 months of age use repellent on the exposed skin, cover crib, stroller, or baby's carrier with the mosquito nets, and use of repellents, and like I already discussed, having ingredient like DEET, icaridine, IR 3535, or Isle of Lemon, eucalyptus, paramenthane, diol, and do undecanone. This is the whole story, how the Zika virus enters into human body, and from person to person it transmitted, and not only from male to female, but also to the baby, and again from the person to the mosquito. That's the cycle of the Zika virus. These are the possible outcomes of the newborn, the woman infected with the Zika virus, and the possible consequences of the Zika virus infection in the pregnancy. This is the first update about this Zika virus disease. Article published in 2020. Zika virus laboratory detection is usually performed by the reverse transcriptase polymerase chain reaction assay, and most from the blood samples, serum or plasma, whose sensitivity is highest up to 5 days after symptom onset. Several reports have described the presence of Zika virus RNA in other body fluids than blood, such as urine, semen, saliva, vaginal and rectal secretion with variable sensitivity. This study was carried out in 2020. Again, this a study about the update of Zika virus Zika virus was found to replicate in human testicular tissue and male germ cells and furthermore persisted in semen, resulting in high risk of sexual transmission. Zika virus preferentially infects brain cells, particularly human neuroprogenitor cells, which may explain its ability to impair development of fetal brain and causes microcephaly. Remarkable efforts have been undertaken to develop effective vaccine against Zika virus, and a list of potential candidates have been identified, which several have been reached phase 2 in clinical trial. Symptomatic consequences of cross-circulation of Zika virus with other arbovirus such as dengue virus and chikungunya virus are still poorly characterized. However, since both viruses use the same vector, it is important to continue the main effort in study use of vector control, that is mosquito. This is the latest update about the Zika virus infection, how it has evolved over the period of time from 2007 to 2017. And this is the arrow showing the history from 1947 to 2017, how it has evolved over the period of time. And you can see the red area here, when the outbreak in Brazil occurred in 2016. And from then onwards, in 2016 February, WHO declared public health emergency of immediate concern, but November it was lifted. At the top of the corner, you can see WHO declared Zika virus no longer is a public health emergency of immediate concern. So this is the timeline of various intervention or discoveries which have been done during the past at different time intervals. About Pakistan, although there are no clinical cases of Zika virus disease have been identified in Pakistan, the first serological traces of infection trace back to 1983. An important factor might be that Zika virus infection lacks the is the lack of national unified arbovirus surveillance system. Moreover, patients showing symptom of arbovirus, Zika virus tests are currently not included in our protocols, and 61% of population are living in the rural areas where the fever or headache or joint pain or like this, these are not the important symptom for them to visit for the hospital. Inclusion of Zika virus in torch has been and globally used to encompass the diseases like Toxoplasma gondii, rubella, cytomegalovirus, and herpes virus. Currently, O stands for others and can include syphilis, uh, uh, para, paravovirus, Coxiella virus, listeria virus, hepatitis virus, varicella zoster, trypanosoma cruzi, enterovirus, and human immunodeficiency virus. Recently, Zika virus has been included in the list after 2015 and 16 outbreak in Latin America, and some authors suggest modifying the old acronyms of TORCH for new TORZICH, TORZICH, to highlight the position of Zika virus due to serious congenital disorders associated with Zika virus. And this is the summary of all the things, how it spreads from mother to baby and from person to person, and the symptoms, rash, headache, fever, and itchy eyes, and the control, environmental control, and long-lasting environmental control, personal control, and while staying indoor is the best protective measure. It's showing the human arthropod to human vector transmission pathway. These are the references and quickly the MCQs. The mode of transmission of Zika virus is all except
airborne.
good. Good. Incubation period of Zika virus varies between
B.
it's 3 days to 2 weeks, 3 to 14 days I mentioned in my slide. Zika virus is closely related to all except
Coronavirus.
corona. Zika virus was first isolated from rhesus monkey placed in the cage in Zika forest of Alberta. Infant infected with Zika virus before birth include all except Down syndrome. Virus can stay in semen longer than in blood. Most common symptoms of Zika infection are
Diarrhea.
all
C.
except good diarrhea. See, Differential diagnosis Zika virus include all except its Legionella. Legionella pneumonia is not relating to that. It's the bacteria Legionella, while the other are the viruses. Anyhow, which syndrome is reported in patient following suspected Zika virus?
C.
It's good. Why emerging viruses like Zika and Ebola continue to plague us? It's B. We disturb forest where they quickly exist as zoonosis. Thank you very much. It's all over from me. Any question?
I just want to ask one thing about this. It is sexually transmitted as well as it is transmitted from mosquito to human.
Yes, that's good.
That infected person would be able to spread it through STIs, not a normal person.
Yes.
That person, male or female, should have the history of Zika virus in the past, or they've been being infected with that. And first of all, they will be infected, then they will spread to others.
Of course. What's your question? I
want to
couldn't
say
get to that.
It is considered an STIs. This is Zika virus. It's
Not
one of the disease included in STIs, TOSH and others. What I want to say, basically, it's not directly being transmitted from STIs. First, have to be infected from the mosquito first.
Yes, of course. It's a dual transmission. First, the mosquito infects the person, and from that person, the partner, and the cycle goes on.
Basically, from the infected person to other.
Yeah.
Thank you so much.
That is human arthropod human transmission. I already mentioned. Thank you. Okay.